Hey guys, this is FixerMed. Welcome back to my high-yield immunology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire discipline of immunology in a comprehensive but high-yield manner. This will be part 17 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Today, I'd like to open up the presentation by covering Type 1, hypersensitivity, also known as immediate hypersensitivity. Mechanism: antigen binds to IgE on mast cells. IgE cross-linking, mast cell degranulation, release of histamine plus tryptase. Late response: cytokines recruit inflammatory cells, for example, eosinophils. Further inflammation. Examples: anaphylaxis, for example, bee stings, peanut allergy. Atopic conditions, for example, asthma. All right, moving on. All right, next topic, type 2. Hypersensitivity, also known as antibody-mediated hypersensitivity. Mechanism: antibodies target cells, tissues, or receptors. Examples include Graves' disease, Hashimoto thyroiditis, Goodpasture syndrome, pernicious anemia, ITP, rheumatic fever, myasthenia gravis, Lambert-Eaton, bullous pemphigoid, and pemphigus vulgaris. All right, moving on. All right, next topic. Type 3, hypersensitivity, also known as immune complex-mediated hypersensitivity. Mechanism: deposition of immune complexes, antibody-antigen complexes. Examples include post-streptococcal glomerulonephritis, polyarteritis nodosa, systemic lupus erythematosus, SLE, Arthus reaction, and serum sickness. All right, moving on. All right, next topic, type 4, hypersensitivity, also known as cell-mediated hypersensitivity. Mechanism: T-cell response without involvement of antibodies, mediated by CD8+ or CD4+ T cells. Examples include PPD skin test for TB, contact dermatitis, and graft versus host disease. All right, now that we have covered all of the content for today, let's look at some NBME-style multiple-choice questions to test your knowledge. A 30-year-old male presents to the emergency department with sudden onset shortness of breath, facial swelling, and hives shortly after consuming a peanut butter sandwich. He has a history of seasonal allergies. On physical examination, he is tachypneic with audible wheezing. His blood pressure is 90/60 mmHg and his heart rate is 120 BPM. Which of the following mechanisms best explains the pathophysiology of his symptoms? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The patient's presentation, shortly after consuming peanuts, is consistent with an acute allergic reaction, suggesting type 1 hypersensitivity reaction, HSR. In type 1 HSR, allergens trigger the cross-linking of IgE antibodies bound to mast cells, leading to mast cell degranulation and release of histamine and other mediators. This process results in symptoms such as bronchoconstriction, vasodilation, and increased vascular permeability, explaining the patient's shortness of breath, facial swelling, and hives. Therefore, the correct answer is A, mast cell activation leading to histamine release. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B, antibody-mediated attack on thyroid tissue. This choice describes type 2 HSR, which involves antibodies targeting specific cells or tissues. However, the patient's symptoms and history are more consistent with an immediate allergic reaction rather than an autoimmune thyroid disorder. C, deposition of immune complexes in glomeruli. This describes type 3 HSR, where immune complexes deposit in tissues, leading to inflammation and tissue damage. However, the patient's presentation with acute respiratory and cutaneous symptoms is not indicative of immune complex deposition in the glomeruli. D, T-cell response to skin allergens. This describes type 4 HSR, where T cells initiate an inflammatory response to antigens without involving antibodies. However, the patient's rapid onset symptoms after ingestion of peanuts are more characteristic of an immediate hypersensitivity reaction mediated by mast cell activation, E, impaired T regulatory cell function. While T regulatory cells play a role in modulating immune responses and preventing autoimmunity, their dysfunction is not directly implicated in type 1 HSR. This choice does not explain the patient's acute allergic reaction following peanut ingestion. All right, now that we have covered this question, let's move on to look at the next question. A 45-year-old female presents with fatigue, weight gain, and a visible enlargement of her neck. She reports a history of dry skin, constipation, and difficulty swallowing. On examination, there is diffuse thyroid enlargement with a bruit auscultated over the thyroid gland. Laboratory tests reveal elevated levels of thyroid peroxidase antibodies. Which of the following mechanisms best describes the pathophysiology underlying the patient's condition? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The patient's clinical presentation, including symptoms of fatigue, weight gain, neck enlargement, and laboratory findings of elevated thyroid peroxidase antibodies, is indicative of autoimmune thyroiditis, specifically Hashimoto's thyroiditis. This condition is characterized by type 2 hypersensitivity reaction, HSR, wherein autoantibodies, for example thyroid peroxidase antibodies, target and damage thyroid tissue, leading to hypothyroidism. The presence of autoantibodies attacking the thyroid gland aligns with the mechanism of type 2 HSR. Therefore, the correct answer is B, antibody-mediated attack on thyroid tissue. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, mast cell activation leading to histamine release. This choice describes type 1 HSR, characterized by immediate hypersensitivity reactions mediated by mast cell degranulation in response to allergens. However, the patient's symptoms and laboratory findings are more consistent with an autoimmune thyroid disorder rather than an allergic reaction. C, deposition of immune complexes and glomeruli. This describes type 3 HSR, where immune complexes deposit in tissues, leading to inflammation and tissue damage. However, the patient's clinical presentation and laboratory findings are not indicative of immune complex deposition in the glomeruli. D, T cell response to skin allergens. This describes type Ivor HSR, where T cells initiate an inflammatory response to antigens without involving antibodies. However, the patient's symptoms and autoimmune thyroiditis are more characteristic of an antibody-mediated mechanism. E, impaired T regulatory cell function. While T regulatory cells play a role in modulating immune responses and preventing autoimmunity, their dysfunction is not directly implicated in type 2 HSR. This choice does not explain the autoimmune attack on the thyroid gland seen in Hashimoto's thyroiditis. All right, now that we have covered this question, let's move on to look at the next question. A 25-year-old male presents with joint pain, rash, and fever. He reports a recent streptococcal throat infection that resolved spontaneously. On examination, there are palpable purpura on the lower extremities and tenderness over the knee joints. Laboratory tests show elevated levels of anti-streptolizin O, ASO titers, and decreased serum complement levels. Which of the following mechanisms best explains the pathophysiology underlying the patient's symptoms? The autoimmune attack on the thyroid gland seen in Hashimoto's thyroiditis. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The patient's presentation is suggestive of two different hypersensitivity reactions. Firstly, the symptoms of joint pain, rash, fever, and elevated ASO titers following a streptococcal infection indicate post-streptococcal glomerulonephritis, a condition associated with type 3 hypersensitivity reaction, HSR. In type 3 HSR, immune complexes formed in response to the streptococcal antigen deposit in the glomeruli, causing inflammation and tissue damage. Secondly, the presence of palpable purpura and tenderness over the knee joints suggests a cell-mediated hypersensitivity reaction, specifically type I4 HSR. This response, commonly seen in conditions like cutaneous vasculitis, involves a T-cell-mediated inflammatory reaction against antigens, leading to tissue damage and vasculitis. Therefore, the correct answer is C, deposition of immune complexes in glomeruli, and D, T-cell response to skin allergens. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, mast cell activation leading to histamine release. This choice describes type 1 HSR, characterized by immediate hypersensitivity reactions mediated by mast cell degranulation in response to allergens. However, the patient's symptoms and laboratory findings are more consistent with type 3 and IV HSR, involving immune complex deposition and T-cell mediated inflammation. B, antibody-mediated attack on thyroid tissue. This choice describes type 2 HSR, wherein antibodies target specific cells or tissues. However, the patient's clinical presentation and laboratory findings do not suggest thyroid involvement, but rather point towards immune complex deposition in the glomeruli and a T-cell mediated inflammatory response. D, T-cell response to skin allergens. This option describes type 4 hypersensitivity reaction, HSR, where T cells initiate an inflammatory response against antigens without involving antibodies. However, the patient's symptoms, including joint pain, rash, fever, and palpable purpura, are not characteristic of a purely T-cell mediated reaction to skin allergens. Type I4 HSR typically presents with localized inflammation at the site of antigen exposure, often manifesting as contact dermatitis. In contrast, the patient's symptoms involve systemic manifestations and multi-organ involvement, suggesting a different underlying mechanism. Therefore, E, impaired T regulatory cell function. While T regulatory cells play a role in modulating immune responses and preventing autoimmunity, their dysfunction is not directly implicated in type 3 or IV HSR. This choice does not explain the immune complex deposition in the glomeruli or the T-cell mediated inflammation seen in the patient's condition. All right, now that we have covered this question, let's move on to look at the next question. A 35-year-old woman presents with a pruritic erythematous rash on her forearms and hands, accompanied by swelling and tenderness. She reports using a new brand of gloves while gardening. On examination, there are papules and vesicles with linear streaks on the affected areas. Patch testing reveals a strong positive reaction to latex. Which of the following mechanisms best explains the pathophysiology underlying the patient's symptoms? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. In type I4 hypersensitivity reactions, such as allergic contact dermatitis, T lymphocytes play a central role in the immune response. Upon exposure to an allergen, antigen-presenting cells process and present the allergen to T cells, leading to their activation and differentiation into effector T cells. These activated T cells migrate to the site of allergen exposure, where they release cytokines that recruit and activate other immune cells, including macrophages and neutrophils. In allergic contact dermatitis, the activated T cells initiate an inflammatory cascade, resulting in the characteristic clinical manifestations of erythema, edema, and vesicle formation. The linear streaks seen in the patient's rash are indicative of the distribution of the allergen along the skin surface. Therefore, the patient's symptoms are best explained by a T cell mediated response to the skin allergens present in the gloves she used while gardening. Therefore, the correct answer is D, T cell response to skin allergens. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, mast cell activation leading to histamine release. This choice describes a type Y hypersensitivity reaction, where mast cell degranulation occurs rapidly upon exposure to an allergen, leading to the release of histamine and other mediators. However, the clinical presentation described in the question, characterized by delayed onset and involvement of T cells, is more consistent with a type IV hypersensitivity reaction rather than a type I reaction. B, antibody-mediated attack on thyroid tissue. This option describes an autoimmune response mediated by antibodies targeting thyroid tissue, characteristic of conditions like Hashimoto's thyroiditis or Graves' disease. However, the clinical presentation in the question does not suggest thyroid involvement, making this choice less relevant. C, deposition of immune complexes in glomeruli. This choice corresponds to a type 3 hypersensitivity reaction, where immune complexes deposit in tissues, often leading to inflammation and tissue damage. However, the clinical features described in the question, such as localized rash and exposure history, are not consistent with immune complex deposition in the glomeruli. E, impaired T regulatory cell function. This option suggests dysfunction of regulatory T cells, which normally help maintain immune tolerance and prevent excessive immune responses. While T regulatory cell dysfunction can contribute to various autoimmune and inflammatory conditions, including some types of hypersensitivity reactions, it is not directly implicated in the pathophysiology of allergic contact dermatitis described in the question. Alright guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.